Do you remember when the ALS Ice Bucket Challenge was trending back in 2014? This challenge was invented by Pete Fritz and Pat Quinn to give everyone a split second the feeling of what ALS patients feel every second of every day. My name is Audrey Green, and I currently work as an at-home caregiver for a woman with ALS, so I see firsthand the effects of it on someone's life. This gives me the credibility to speak on this topic, and today I'm going to be speaking on 3 main points: defining what ALS is, the effects of ALS on someone's day-to-day life, and the emotional health effects of ALS on someone. My first main point today is defining what ALS is. So, what is it? ALS stands for amyotrophic lateral sclerosis, which is the disease that is caused by the body paralyzing over time. According to ALS SLA Canada, our bodies all have voluntary muscles, which are muscles that we voluntarily choose to move freely. Within these voluntary muscles, we have something called motor neurons. These are specialized nerve cells which cause our voluntary muscles to move. Things such as wiggling our fingers and moving our arms, stuff like that. However, in someone with ALS, these motor neurons break down and they eventually die, which causes them to not be able to move freely anymore. For example, this is a healthy motor neuron cell. This is a motor neuron cell in someone with ALS. As you can tell, this one seems healthy and this one is breaking down, which shows you kind of an idea of what it's like. Now, coming to my next main point, how ALS affects someone's day-to-day life. According to the National Institute of Neurological Disorders and Stroke, early-stage ALS patients experience muscle cramps, twitches, and weakness. However, as ALS progresses and the disease continues, people start to lose the ability to walk, stand, use their arms and legs, they have difficulty chewing, and many other issues such as breathing, the ability to ventilate. People have to go on ventilators. It's a lot. People also eventually lose the ability to do their own day-to-day life things, such as brushing their teeth, getting dressed, being fed on their own, bathing on their own. The list continues. They eventually lose all of their independence, which brings me to my next point: the emotional health effects of ALS on someone. Now, as you can imagine, such a large lifestyle change can hurt someone's emotional well-being. A quote from ALS News Today states, "Those with ALS can also experience things such as depression and anxiety. Scientists do not know yet if it's related to the progression of the disease or the emotional impact of it. Patients can withdraw from social situations and feel isolated due to the symptoms of the disease. These patients wake up every single day and they slowly lose the ability to do their day-to-day life things. For example, imagine waking up and not knowing if tomorrow you're going to be able to brush your own teeth. And not to mention that ALS is a fatal disease and there's no known cure, which is also worries and gives anxiety to many patients. Now that I have discussed what ALS is, how it affects someone's day-to-day life, and the emotional health effects of ALS on someone, I hope that all of you now have a deeper understanding of the awareness of ALS and its effects on someone. If you are willing to donate and help find treatments and maybe a cure to ALS, the ALS Association's number is 888-949-2577. Also, if you want to experience what it's like to have ALS, consider trying the Ice Bucket Challenge. Thank you, everyone.